I'm Jane Bridges, back with Module 4. Let's talk about how your office visit should be when you visit your healthcare team. And of course, this is what we do in my practice. I know your primary care providers may have a different routine. I understand that, but this is what you can expect if you're one of my patients. You'll have routine office visits every 3 to 4 months, providing it's just routine. We'll have more frequent visits every 1 to 2 months if I have some concerns about how well you're doing. And sometimes I've been known to put patients on probation, and I'll see you back in 2 weeks if I feel like you are definitely going in the wrong direction and need a little bit more of my support during that time. Now, each visit, a routine visit, is pretty consistent at every visit, so you can expect the following. I will ask you if you have any questions, concerns, or issues related to your diabetes that I need to address at that visit. I'll ask about recent surgeries, or recent hospitalizations and ER visits. I kind of want to be updated on what's been going on with your health. I'll give you an opportunity to ask questions. I recommend you write them down because when I am headed out the door is not the time to start asking me questions. Use our office visit to get all of your questions answered. From there, then, I do a very routine review of systems, and I start from the top and I go to the bottom. I'll ask you how your energy level is, and I'll watch it. Is it dropping? And why is it dropping? Why are you having less energy? I'll inquire about how often you're urinating through the night. Several reasons why. Men who have prostate problems may have more urinary frequency. If you have sleep apnea, you may be getting up at night to breathe on the way to the toilet, so I will start to inquire about snoring and ask questions related to that. You may also have excessive urination through the night just because of diabetes out of control. So I take one little question and that answers and gives me a lot of information because I inquired about it. From there, I'll ask about any coughing, cold symptoms you may be dealing with. I'll ask about changes in your vision, and I'll want to know when your last eye exam was and who the doctor was. Our charts get audited all the time by your insurance companies, and they're looking for these eye exams. So whenever you go to the eye doctor, ask the eye doctor to please send a copy of that eye exam report to your primary care provider. And if it's me, send it to me. Okay? From there, then, I ask about chest pain, chest heaviness, or chest discomfort. I'll inquire about problems with breathing. I'll ask about any gastrointestinal symptoms like nausea, vomiting, diarrhea, constipation, heartburn, or abdominal pain. I'll ask about urinary tract symptoms. If there's any burning or discomfort, yeast infection issues, we'll inquire about. From there, I'll go on to your legs, any back pain, leg pain. Patients with diabetes have a lot more back, leg, knee, hip pain, so I inquire about that. I'll ask about numbness, burning, tingling, sharp-shooting electrical pains in your feet, legs, hands. We see a lot of carpal tunnel as well, so I inquire about that. I'll ask if you've been falling. I'll ask if you have any issues with depression or anxiety that you've been dealing with since we last saw you. And during COVID, we've had a lot more anxiety and depression that we've been addressing during this time. I'll ask about drug and alcohol use because I've been burned a few times. So now I'm asking at every visit, inquiring about how much alcohol you may be consuming that could give me a clue about why blood sugars are so hard to manage. Okay. From there, I'll do a physical exam. I listen to your lungs. I listen to your heart. I go to your neck and I listen to carotid bruits on each side of the neck, and I feel that thyroid. From there, then I go to the legs, and I'm feeling for a swelling of your legs. I'm looking at your feet, the conformation of the foot. I'm looking for any foot ulcers and calluses. I might trim toenails if they're terribly long and pose a threat to the well-being of your feet. I will do anything to save my patient's feet. I feel that strongly about that. So that's why your feet are examined at every office visit. I'll review your vitals with you. I'll tell you what your blood pressure is and what direction your weight is going in. From there, then, I start to look at your blood glucose data, whatever we downloaded from your meter, pump, sensors. I start to look at that, and you'll see me input that data into the computer. I'll make decisions off of that data. I'll look at your labs. I'll tell you if you're due for labs. I'll review your labs with you. I'll ask you if you have any prescriptions that need to be filled. And then finally, I'll conclude by making final adjustments in your medications, whether it be blood pressure, cholesterol, or diabetes medications. I'll order any labs that you're due for. And then I'll ask you finally if you have if there's anything else that I can do for you. So I let you conclude the office visit. And if we've hit every topic, answered your questions, then I conclude the visit and I'm on my way to the next patient. Okay, let's talk about standards of care. These are things that need to be done or ordered every year, at least once a year. So we need to have hemoglobin A1Cs every 3 to 4 months, or typically at every visit. And then yearly, we order a lipid panel. And this is a panel that looks at your good and bad cholesterol. We check cholesterol, triglycerides, the HDL, which is the good cholesterol, and we want the good cholesterol to be high, HDL and high. The LDL is the bad cholesterol, and we want that to be low. Okay, you do not need to be fasting for my patients. I know other doctors request that you be fasting, but I do not. I always check a chemistry panel, a complete panel that has kidney and liver functions along with electrolytes. I don't just get kidney function or liver. I get it all together all at the same time. I always order a CBC every year, and this is a test that tells me if you have anemia, because we pick up quite a bit of anemia, and some of the medicines we prescribe cause anemia. Metformin can cause B12 deficiencies that could lead to anemia. So it's important that I know that you're not anemic, that could cause some problems for you down the road. 1 out of 5 patients with diabetes have thyroid abnormalities, so I always check a TSH every year. I get a complete urinalysis. I'm looking for infections that may be silent. I'm looking for blood that's unexpected, just in case you might have kidney stones or a little bladder tumor that needs to be tended to. And then I also check for microalbumin, and this is a small amount of protein in the urine that we're looking for. And then we ask that you have an eye exam every 1 to 2 years, and that a copy of that eye exam be in the chart. So let's talk about sharing information. A lot of times people see other doctors. And so if you've had labs or procedures done at another facility, please hand carry those results to your office visit of your primary care doctor so we can see what they were. We can answer any questions related to those tests you may have, and it keeps us from ordering duplicates and creating unnecessary cost. I've already talked about a copy of your eye exam in the chart. And then let's say that you're going to be having blood work that's being ordered by another doctor. Ask us if we need anything, so we can combine it so you only have to have one venipuncture out of your arm instead of multiple lab tests. So let's conclude about this health maintenance, again, to prevent premature death and disability. Health maintenance involves routine office visits. It's interesting because of COVID, I'm seeing patients that I've not seen in about 1.25 years. So we do want you to have routine office visits. You'll need to see your doctor on a regular basis. Routine lab work that I've already mentioned, that eye exam that's so important. And then we want to focus on risk factor management, managing diabetes, controlling hypertension, controlling good and bad cholesterol, and most importantly, not smoking. And then finally, in regards to health maintenance, again, your participation, lifestyle changes and choices, good healthy food, less junk, less processed food, more exercise, wellness, and basically self-care. And then medication adherence. Taking your medicines really work. But if there's a reason why you're not taking them, you're forgetting them, or you can't afford them, please have that conversation with us.